All right, shoulder pain with pressing. Who has it? Usually people that are training for something, they're weightlifting, overhead athletes, weekend warriors, maybe they're a CrossFitter, maybe they go to some type of group fitness class. But here's a common thing, what we'll see is most people, they're doing a strict press, or we call a shoulder, a military press maybe. Eric's gonna demo it for us here. He's gonna press up overhead, and that's great. And we'll go back in the rack. And do you have pain with a motion like that, with this pressing, or do you know somebody who has pain with a motion like that? Typically what we'll see is people will have pain in the front of their shoulder. Sometimes they might have it in the back of the shoulder, and it feels like either this sharp, dull ache, or just almost like catching sensation people will complain of. Why is that happening? Well, a couple things. You guys have this thing called a rotator cuff that basically bear hugs your ball and socket joint. I'm sure you've heard of that. The shoulder is a ball and socket joint. The rotator cuff, it basically bear hugs that ball and socket, and its job is to keep the ball centralized in that socket throughout motion. So sometimes there could be a cuff weakness. The other thing is it could be just a very, very stiff shoulder. A lot of people, right, we're really, really tight in our pecs and maybe even in our lats, and those are considered internal rotators. So you got somebody's shoulder who's sitting like this and they're not able to maximize that full range of motion that they need in the joint. Another reason could be, it could be something going on in the spine. If somebody's very, very leaning forward like this, am I gonna be able to get my arm up over like that and maximize that glenohumeral joint, that ball and socket motion? Probably not. Okay, so a couple of things that are working for this that we typically see with most athletes who are having pain with pressing. We wanna get that rotator cuff going, right? We got three of those muscles that sit on the back of the shoulder blade that are gonna be responsible for doing this external rotation. So most of you have probably seen an exercise like this, like Eric is doing. He's just gonna be out here and he's just gonna rotate, externally rotate. That's a great exercise, but how can we make that more applicable to what you're having pain with, right? So maybe I have him rotate out to the side here, and then I'm gonna have him bring his arm up, and now I'm gonna have him turn away. He's gonna do a trunk rotation. Does that not look like the starting position of where we would be? Looks pretty darn similar, right? And then a good progression from that would be the same thing again, rotate away, and now let's press overhead. So now he's having to pull back, keep that cuff activated while he's pressing there. And that looks very, very similar to our strict press, right? And now we got the cuff working. So that's something that works very great for us. And then the other thing that we could look at is, for a lot of weightlifters, they come in and we talked about these internally rotated shoulders. It could be due to a pec, or it could be due to a lat. And if we're having a lat restriction, we can't get good rotation of the shoulder blade, which we need up. So how could we mobilize that? Well, the good thing we could do is we got a nice little rack here. So I'll let Eric kind of grab rack here. And what he can do is, maybe I'll have you face this way, just so you can see the side. Yep. And then what we're gonna do is, we need to mobilize this here, but we need some thoracic mobility, right? So what we're gonna do is, we need a little bit of rotation. I'm gonna have him take this arm and do a little bit of a thread the needle. So as he turns, he gets more here. Can you feel that more as you turn it? And we're coming back. So opening that up to allow us to maximize our full shoulder blade mobility. And then after we get a little bit more mobility here, we can train that mobility to provide the stability so we can control it. Those are a couple things we're finding that are working right now. Okay. Those are just a couple things that we have found that have been successful, but what if it's not successful for you? Is it the right exercise for you? Is it the cuff that's having irritation? Is it tight? Is it tight restrictions? Stiffness? Is it weakness? Guess we don't know. The only way to really find out is to take you through a comprehensive exam, because 9 times out of 10, I'd say I'm seeing people that have tried some of this stuff and they're not getting help. So is that the true cause? Could we use something like a 3D map screen where we're assessing all vital 66 joints and all 3 planes of motion going forward, side to side, and rotation to make sure that that's truly the cause of the shoulder? Because it could be the hip, could be the spine, could be a foot. We don't know. But you need a personalized plan developed that's focused towards you and what's causing your true pain.